Hi, I'm Dr. Matthew Norton, founder of People Plus Purpose, and your host on this episode of the Truth Behind Dentistry podcast. And today, I am excited to be with Dr. Al Dadenberg, who is a nutritional periodontist, certified functional medicine practitioner, and balanced metabolic coach. After a terminal cancer diagnosis in 2018, he shares unconventional cancer protocols that have helped him and has written multiple books, including his newest, Eat as If Your Life Depends on It. Welcome, Dr. Dadenberg.
Thank you. Thank you so much for the kind words. I appreciate it.
Absolutely. I've been very much looking forward to this conversation. And as we were talking before we went live with this, we've got about 20 minutes together approximately today. And so I would love for you to share kind of some of your most passionate message, maybe is a good way to say that, as a result of your journey with cancer. And maybe to get us started, tell us a little bit more of your story, maybe leading up to that diagnosis and then since.
Well, it's very interesting. It's a long story, so 20 minutes isn't enough time. But in 2018, so I was 71 years old at the time, I was basically considering myself a very healthy guy. And I was very active. I was writing, I was lecturing. The world was my oyster, so to speak. And I was traveling to Austin, Texas to speak at the PaleoFX meeting. Started to have some soreness in my right shoulder, thought it was a pulled muscle. And by September of 2018, I finally got motivated enough to see my medical doctor and said, something's going wrong here. What's happening? He did a bunch of tests. Most of the tests were negative, actually. He did a systemic inflammation test called a C-reactive protein that showed it was out of whack. And he said, let's do some more testing. He did that. We did an MRI. He finally discovered on the MRI some changes and thought that I had either lymphoma, multiple myeloma, or leukemia. That was devastating. Here I am thinking I am literally the picture of health, and turns out that I have cancer. How could that possibly be? I was in a state of eating like paleo lifestyle for at least 6 or 7 years before this diagnosis. So how could this happen to me? And we can get into the details. Cancer doesn't start a week or 10 days or even 10 years before it manifests. It can take decades, and we can talk about that. But here I am. Literally, my life is racing in front of my eyes, because I know that everything that's going to happen from that point on is going to change my life. He sets up an appointment with an oncologist. We confirm with a bunch of other tests that I have IgA kappa light chain multiple myeloma with severe osteolytic lesions in the bone. And what that means is I have a bone marrow cancer that is destroying the internal surfaces of my bone. So they're becoming very fragile. They break very easily. And then I was given 3 to 6 months to live. Now, cancer is a big deal, but 3 to 6 months to live is another shocker. Now, since this cancer that I have is incurable, I elected not to do chemo, although it was suggested I do that, because it would just put me in and out of remission for a period of years, but my quality of life would be deteriorating. And why, in my mind, why would I want to destroy a weakened immune system even further? There must be another way to just support this immune system, to build it rather than destroy it. And I created what I call my unconventional cancer protocols, which has evolved and I've tweaked since 2018, even until today, that I follow very closely. And I did very well. I had some setbacks, some severe setbacks. Actually, a year later, I had some severe bone fractures of my humerus, my right femur, my ribs, all at one time, put me in hospice to die. But in a month, I revoked it. I got better. I revoked it. My oncologist was shocked I was still alive. got back to my unconventional cancer protocols, and I'm doing well. The biggest thing that happened to me that has reactivated my malignancy was actually COVID. And COVID, if you're familiar with it, I'm sure you are, it affects your immune system, causing your plasma cells to produce antibodies to fight this infection. And of course, it does a lot of damage to the other internal structures of your body. Well, my immune system, made up of plasma cells, is the malignancy. So when I had this COVID, it activated my unhealthy malignant cells, creating unhealthy or dysfunctional antibodies that reactivated all this multiple myeloma, making me much, much weaker. And I'm dealing right now with long COVID, which is some symptoms that are allowing me, unfortunately, to be very exhausted at this point. But I'm continuing with my unconventional protocols, doing what I can do. I'm going to be adding a few more things along the way. We can talk about that later on if you want. And then, again, my bottom line is my quality of life. I want to maintain that as best as I can.
Well, thank you for sharing all that. I guess what I'm inclined to want to say is my heart goes out to you for all that you're having to deal with. And I'm glad you're still here, and I'm glad for the choices that you've made that have allowed that to be. Obviously.
Well, thank you. But everybody deals with their own thing. When you said, what's an important thing that I can bring to other people? And that is, excuse me, if you have a serious condition, medical probably, cancer maybe, chronic generally, there are things you can do to improve your lot in life. And if you just look at a physician with a big white coat tell you that it's all over, or that you have to do this that's going to destroy your body, or nothing else will work, I would look into different avenues that help your body heal itself. You may never heal yourself completely, but you can always get better than you are currently if you do certain things.
So it sounds like you're saying that just the hope and a positive expectation that you can be empowered to take action as opposed to being more of a passive recipient of a diagnosis.
Absolutely. Probably more people suffer and die prematurely when they believe that they are the victim and they have no other option.
Yeah.
And the emotional stress of that thought, which is quite distressing, obviously,
yes.
can play havoc no matter what else you do in your body.
Yeah.
So controlling emotional stress is one of the elements of my unconventional cancer protocols. That's a critical element.
Yeah, that's good. That's good. Well, kind of stepping back a bit, incorporating some of those things you were just saying, given the fact that you've had a long career as a periodontist. So we're talking to dentists, hygienists, others in the dental world, hearing your story, wanting to apply something. I'm certain from what could they learn from you, in kind of researching your books and messages, seeing that you speak about the connection regularly between the mouth, the gut, chronic inflammation, and autoimmune disease. Not that you have to address all of those things, but what might you say to this audience of people listening relative to those connections that they may or may not be greatly aware of?
Couple things. The mouth is generally a mirror to the health of the body. So you can see things in the mouth, not you maybe as an individual, but a trained dental professional who's more biologically oriented can see changes in the mouth, knowing that these are related to other bodily functions that are mirroring the body. The biggest problem is you go to a dentist and they see inflammation and they say, oh, you've got gum disease, let's kill all this bacteria. without realizing, and this is very important, without realizing this inflammation probably is starting in the gut and manifesting in the mouth as the first area to be seen.
Hmm.
Even a good biological dentist doesn't understand that connection for the most part. Now, here's a caveat. If you have problems in the mouth, like a broken filling, or a root canal that's not healing properly, or an extraction site that has left some toxic material in the bone that is causing a what's called a cavitation, or something that's not fitting well, like a crown or a partial denture that's irritating, that can initiate its own inflammation and infection. And you don't have to have a problem in the gut to have that happen.
Okay.
But generally, if you have or not have those irritants in the mouth, to get periodontal disease, you have to have a change in the bacterial garden in the mouth. And to make that change, the gut is a critical factor. When it becomes dysbiotic or becomes pathogenic, with an overgrowth of pathogenic or unhealthy bacteria, changes the immune system, changes the flora or the bacteria in the mouth, and it becomes systemic, meaning it flows through your body, not just the blood system. It can travel nerve canals, it can travel fascial planes. Those are the spaces between one tissue and another soft tissue of the body. And all of this can affect every cell in the body in its own way, even causing cancer, even causing chronic autoimmune diseases. And these are the factors that must be controlled along with the mouth. But the gut must be looked at and treated concurrently with the mouth problems, not one or the other. Definitely the gut must be treated with the mouth.
So given that very holistic vantage point, again, as we're talking to people who are specializing in the mouth and have more or less knowledge or expertise in any of those other elements, what do you see as opportunities? I mean, it kind of begs the question then for people coming in, and here's what we're finding in the mouth. Here's what we're inclined to be needing to treat in the mouth. What are some opportunities that you see to be more expansive for people who are in that world, seeing those things to contribute at a higher level to the health and well-being of these patients that are in front of them?
In my opinion, every dental office, when they see a patient, not just the original appointment, but every year when they do reviews of a patient's history, should have the patient fill out a very detailed 3-day food journal, so you understand and the dentist understands exactly what you're putting in your body and what exactly you're not putting in your body that is critical to have. Other things are important, also chemicals in the air and in the other environmental factors that you're living within. But this is critical so that we know what's going in and also what you're trying to avoid. There are some tests that can be done to look at the health of the garden of bacteria in the gut. Many of the stool tests that are available are not very well designed, but there is a test that can be done that is what's called whole genome sequencing. That's the lab technology of looking at the individual genetic makeup of all the species of the bacteria in the gut. And they can determine living and non-living microbes that are in this garden. And it has to be a diverse garden, meaning many, many different species with many, many numbers of different species. Because when you have many different species of the microbiome in the gut, it crowds out potentially pathogenic bacteria.
Mm.
And your gut microbiome is as unique to you as your fingerprint.
Mm.
So to say you have to have this number of bacteria in your gut or you won't be healthy, or that species or you want to be healthy is nonsense,
Hmm.
because everybody is unique. Now, everybody may have different amounts of these bacteria, but your uniqueness makes you healthy at a certain level. So this test can help determine what's called alpha diversity, how diverse of species you have and number of species that are in your gut. You want to have the highest alpha diversity as possible. You want to be as close to the 100th percentile, meaning nobody is as diverse a gut than you have, ideally, and that's not going to happen, but close to that number. Then there are some other tests that may or may not be effective, but that is a good test. The other thing is you need to understand, even if you don't know how unhealthy the gut is, you need to know what you need to do to make that gut healthier.
Hmm.
So let's assume there is a paper that was published in 2019 that showed that the US population, of the adult population, 88% at least, is metabolically unhealthy. That means they automatically have damage in their gut and it's systemic, creating chronic inflammation and other chronic diseases. That's a huge, huge number.
Yes.
So what do you do to correct that? Well, you need to do things that are going to change the diet, get rid of individual foods that you think are healthy that have a lot of chemicals and maybe proteins inside plants that are called anti-nutrients that are damaging the gut microbiome without realizing it. And these are accumulating over decades. So if you ate some food that's not so healthy today, you're not going to get sick necessarily next week. But if you eat that every day, in 10 years, the accumulated damage could create the problem that all of a sudden seems to manifest, yet it's began growing its problems 10 years before. So if you change the diet to only healthy, non-toxic, non-inflammatory, nutrient-dense foods, which I work with my clients all the time, and build up this gut microbiome diversity, and then maybe do the specialized tool test later on just to see how well you're doing, would be the steps to initiate overall healing and supporting a robust immune system. And your immune system is everything you've got that makes you healthy. If you have a dysfunctional immune system or a weakened immune system, you're getting sick. And if it doesn't function properly, it will kill you. And that's what keeps you alive and me alive. And this
Right.
is what I believe has helped my malignancy to stay where it has stayed, the quality of life that I am enjoying, because I have spent detailed time eating the way I should eat, avoiding what I should avoid, and improving my gut microbiome.
That's great. Thank you. And these are all things that a good starting place maybe for people to get. I know that quote kind of came out of your newest book, Eat as if your life depends on it. So do you go in that book, do you go into some of these, both some of the diagnostic elements to know about gut health as well as the dietary changes?
It's more involved with the foods and avoiding bad foods that actually will enhance the gut microbiome automatically.
Okay.
There is a clinic in Budapest, Hungary, that has been treating patients for the last 12 years or so. It's called the International Center for Medical Nutritional Intervention. And they treat only chronic diseases and very serious cancers, and with a strict animal-based diet. And they do case reports, publish them, and anybody can read them if they want. They have an English translation of these reports, and it's quite impressive. And they do not do anything with the gut per se, and they do not do anything with medications or supplements. It's just the way they eat that supports the gut. Now, I believe that the way you eat is a critical element, but you can support the gut to get a better, quicker response. And I think that to incorporate that is a very healthy way to go, and that's what I do.
I see. I see. Coming back to the dental office again,
Yes,
for those that are listening who are thinking, man, this not only seems critically important, but I'm interested. What more could I do? I'm interested in your thoughts on how this can play out on a day-to-day basis in the dental office. Part of it, as you're saying, is asking the right questions, tracking food intake in a food journal, as you were saying. When we look at like roles in the dental office, who's given the fact this is not happening in most dental offices or specialists' office, uh, how do you see this options maybe for this playing out? Someone who, like a hygienist or someone else in the office who could spearhead a larger health advocacy, monitoring and engaging the patients beyond just the oral health situation, or what I believe so much more is possible, and I would love to see people
it is.
get into this.
Actually, I wrote a program for the International Academy of Biological Dentistry and Medicine, which is a certification program to help dentists, biological dentists, meaning that they're interested in the integration of the whole body as well as the mouth, to become more aware of a food journal and how it relates to the mouth and how it relates to the gut and make some changes. The sad thing is none of this is taught in medical school or dental school. That's amazing to me, but
Yeah,
it's not.
yeah,
You go to your doctor, he has no idea. Even if you go to an oncologist who should know that you shouldn't be eating sugar if you have cancer, in their infusion clinics, the nurses are giving snacks of chocolate chip cookies and Coca-Cola. So, I mean, there's something wrong with this picture, right?
right.
So I don't know where that's going to end up eventually, but an individual can do their research. And the best person in the dental office to help you is a dental hygienist that understands how to clean the mouth efficiently, not just concerned with brushing and flossing, because bleeding in the gum tissue, in my mind, it's not a problem with the tooth itself. Bleeding in the gum tissue is directly a result of gut dysbiosis. Gut dysbiosis, not oral. It gets to be oral, but it starts with the gut. So understanding, changing the diet, changing the way this garden of bacteria grows in the gut to make it healthier, and then understanding how you can clean your mouth appropriately and efficiently on a daily basis is important. You don't want to use antimicrobial toothpaste or mouthwashes or substances that destroy dental plaque. Dental plaque is healthy until it's not. You don't want to remove this natural biofilm. The dental plaque, this film, this thin biological film that's at the gum and tooth margin, plays three important purposes. It's made up of maybe 700 or so microbes, and it creates hydrogen peroxide that kills potentially pathogenic bacteria in the saliva that prevents the bacteria to get under the gum to create gum disease or tooth decay. It has buffers, chemical buffers in this dental plaque that keeps the dental plaque pH, or the acid level, to a certain point and no more acidic, so that tooth decay doesn't occur. In other words, dental plaque prevents tooth decay if it's healthy. And the other thing dental plaque does is it functions as a gatekeeper, allowing the minerals in the saliva to penetrate into the root surface to remineralize or harden the root 24 hours a day, 7 days a week when necessary. So if you strip away this dental plaque, you remove the protective layers, like taking today's scenario, a police officer going out on the streets without a vest to protect him from a bullet shot. This is a critical biofilm that should not be removed. And I would say 99% of dental offices want to kill the bacteria in the dental plaque, I want to prevent the dental plaque from forming on a daily basis. And that is not correct. And that's a mind-blowing statement, because you go to your dental office thinking that you're getting the best treatment in the world. You know that they're charging you enough money to know what they should know, yet they're in denial of the benefit or the biological benefit of dental plaque in the mouth.
Yes, I'm sure that there's plenty of people who just heard that.
And that makes me very controversial, obviously,
yeah.
because I have had arguments with dentists that say I have no idea what I'm talking about, yet they have no idea what they're talking about.
Yeah. Well, different worldviews. Is somebody right and somebody wrong? Probably a lot of the
But
time.
you know, the fact is, the facts are facts.
Right.
I'm the messenger. I'm telling you what the way it is.
Right.
This
right.
is biological. If you want to believe dental plaque is unhealthy and you have to remove it every day, it doesn't make it unhealthy because you said it. Now,
Right.
you can have unhealthy dental plaque because you have gut dysbiosis, you're eating a lot of junk, you're growing a lot of pathological, pathogenic bacteria over the healthy dental plaque, and now it is unhealthy. But let's get back to the healthy dental plaque, but not destroy the healthy dental plaque.
Yeah. Well, and I think it's indicative of, in general, we're not talking just professionals, but we're like the public in general doesn't understand the microbial world at all. And
No.
all microbes are bad, kill them all. And they don't realize they are made up mostly of microbes. And so,
right, if you look at the statistics, which are another fact, we have 38 trillion microbes in our body, most of them in our gut, and we're only made of 30 trillion human cells. So we're more microbial than human. That should set you a little bit off your game plan.
Right. Yeah, that's controversial, right? It's not. It sounds controversial to people.
Yeah, of course. It sounds like science fiction.
Yeah, I know. Well, this is, Judge, we're already at the end or a little bit past our time, but it's fascinating speaking with you. You are a wealth of knowledge. I want to know more. I want to hear more. So I'm hoping that the listeners are committed to move further in this direction. I'm hoping that they will reach out and communicate with you. So I want to have you share maybe a couple of good ways, first steps, if people want to know more. How would you have them contact you, and what resource or two might you recommend?
Sure. So you can get in touch with me from my website. So it's drdadenberg.com, drdadenberg.com. There is a contact button on the navigation bar. You can click that and ask your question. I answer all my own emails, so that's not a problem. You can request a PDF. I'll send you absolutely free, of course, on how to take care of your mouth. 4 steps to a healthy mouth. And it'll show you with pictures exactly what you need to do and what I recommend. I have many, many other articles and PDFs that talk about the steps for a healthy mouth, how to pick a biological dentist, questions that you have to ask them, what could be going on in your mouth that you're not aware of that are cause problems. It's all available. I do offer consultations. I do consultations all over the world. I do a 30-minute free consultation for anybody just to talk with me and see if we're a good mix together. And then I do coaching programs that last 12 weeks, but we can discuss that at a free consult. And you can just ask me what you want to ask me, and I'll give you all my answers that I can.
Well, I appreciate that, and I really hope that our listeners will take you up on that, because whether they have an overt perceived need right now or simply a curiosity for how they can be better, I hope they will take an action. And so I would like to plan. If you're up for it, I would love to come back and have.
Oh, sure, absolutely.
Because I think we just barely touched the surface, and it's too good to not have more. So I appreciate you. I thank you for your time and your wealth of knowledge, and I would look forward to that.
Thanks, man. I appreciate it too. Thanks for the opportunity.
Absolutely. Thank you. So for everybody who is with us, this is Matthew Norton with People Plus Purpose, and I'm with Dr. Al Dadenberg, and I hope that you have found not only one or two nuggets of value, but that this has captured your attention and imagination, and I hope you'll reach out and get more information in this direction. So I thank you for being with us, and I look forward to our next episode and having you join us. Thank you.